All right, a very good morning to you. It's good to see you right here on Your World. I hope that your Wednesday is coming along very well. It's Wellness Wednesday, and it's tradition right here on Your World. Every Wednesday, we talk about anything and everything health-related and wellness at the same time. And today, like I teased earlier on, we'll be talking about acupuncture and chiropractic care. And I know majority of us are like, okay, first of all, what exactly is that? I'm pretty sure you've seen someone, medungo some things with some needles, and you're like, yeah, that looks painful. Or maybe if you are online and you've come across videos of people, you know, being cracked on their necks and the backs and the entire body, and you're like, what exactly is that? And is it effective? First of all, and what are some of the conditions that maybe might necessitate you to actually go for either chiropractic care or acupuncture? Does it help with pain? I mean, listen, all those questions will be answered today on the show. So you want to stick around until the end. Do not miss any single part, because later on at some point in the show, we'll actually be showing you how this is done practically, okay? And we'll have one of us being cracked, literally. But again, if you have any questions, send them our way, and that is at NTV Kenya, both on Facebook and on X. Today, we're not asking you any question. We want you to ask us any question that you have as far as chiropractic care is concerned or acupuncture. And we look forward to getting your questions and forwarding them to the specialist on set today. Now, my guest today, we have Dr. Margaret Stower, who is a chiropractor right here at Polycare Wellness Center. And that is exactly where we are today, and that is at Polycare Wellness Center. Doctor, it's so good to see you. I am really tempted to say Happy New Year. I haven't seen you in a while. How are you? How are you doing?
I'm doing so great.
And you look lovely.
Thank you.
You look really beautiful. I wish I got the memo to also wear it, but I have red on my shoes, so...
It matches.
Right? It's the month of love. It's not yet done. And later on, we'll also be joined by Elsa Cred, who is an acupuncturist, to also help us understand what acupuncture, is all about and what are some of the conditions that it helps with. But before she comes, Doc, can we start with chiropractic care? Because like I said, we see these videos online. So they look scary. They look painful. I have done it. I have done a session on, chiropractic care at some point, and I was nervous, but you feel good after, right? So for someone who's probably coming across this term for the very first time, and they're like, what exactly is that? Because it sounds like a very big word, you know? Yeah.
Chiropractic actually comes from the word chiro, meaning hands, and practice. So the Greek word of chiro means hands, and practice is practice.
Okay.
So we practice with our hands. It shouldn't be painful, and it shouldn't be scary.
Okay.
But chiropractors are healthcare providers. They are very well trained. We actually undergo 4 to 5 years of training as a postgraduate degree after having done your 3-year undergraduate degree.
Okay.
So they're very well trained. And the chiropractors deal with the musculoskeletal system of the body, meaning the muscles, the bones, the ligaments, the tendons, and the nerves that pass through the body and the nervous system.
Now, can we get to understand how different it is chiropractic care from massage? Because you see, we have like different types of massage. There's Swedish, there's deep tissue, and all of them actually, it's the use of hands, and there's the way both masseuses and now chiropractors actually work with their hands, right? So is it the same? Is it different? Is it a discipline?
It's different.
It's different.
As I said, chiropractors are very well trained.
Yeah.
They're trained like medical doctors. So during the program of the 5-year program, we actually undergo anatomy, physiology, pharmacology, microbiology, biochemistry.
You study all this?
We study all this, and it's a 5-year program, a degree program, after having done your undergraduate degree. So chiropractors are very well trained. There are massage therapists that are trained as well, very well, but chiropractors have an in-depth knowledge of the human body.
Absolutely.
As I said, we train like medical doctors. We don't call ourselves medical doctors because our philosophy is so different. Our philosophy is the body's ability to heal itself without too much intervention. So no medication. In fact, one of the things that I really like to quote is a quote by Thomas Edison. Thomas Edison was an inventor in the 20th century, and he invented the light bulb. But he said that the doctor of the future will give no medication, but will interest the patient in the care of the human frame.
All right.
And
Can
diet.
we hold on to that? Because now I want us to really hear that. There's a bit of an issue with our mic. Let's sort that out. We go on a break, and then when we come back, we'll pick up from there on that quote, okay? Because like you said, the body has an ability to heal itself that sometimes we have not tapped into and get to know it very well. So we'll delve deeper into that. And again, like I said, if you have a question for Dr. Stower, feel free to engage with us on our socials. That is at NTV Kenya, both on Facebook and on X. So let's take a very, very short break, and then when we come back, everything will be okay. And we'll continue with the conversation. All right, welcome back. And just in case you're tuning in right now, today our conversation on Wellness Wednesday is on chiropractic care as well as acupuncture. And we have started the conversation a little bit earlier on, and Dr. Ari was telling us a little bit about a quote which we're going to go back. And we're coming to you from Polycare Wellness Center right here in Nyeri South. We have Dr. Margaret Stower, who is a chiropractor, helping us first of all understand what is chiropractic care and who goes for it. Okay, what are some of the conditions that chiropractic care actually helps with. And Doc, so yeah, that quote, can we just go back to it?
Yeah.
And then now we'll focus on
there was a quote that I do remember by Thomas Edison.
Yeah.
Thomas Edison was an inventor in the 20th century, and he invented the light bulb. So he did say that the doctor of the future will give no medication, but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease. And I think at that time he was really thinking about chiropractors.
Right? And even in the here and now, because now we're getting a lot of conversations around preventive care and also allowing the body to heal itself and limiting more on the medication and just giving the body time to heal itself. So yes, I think I was talking about chiropractors, earlier on. Okay, so then understanding chiropractic care, right? What are some of the first of all, what does it do to the body? Because like you said, you use your hands, you focus on the musculoskeletal system of the body, right? Yes. So what exactly does that entail in totality?
Well, we all know that the organs and every system of the body is supported by the human frame. So having the frame aligned properly, you can actually enhance the nervous flow to all the tissues in the body. So that's what chiropractic does. It just helps you to cope better with whatever condition you'll be going through and you'll be undertaking. So we do little manual adjustments on the spine to correct it. It's like when you have a car and you take it for alignment and it performs better. So chiropractors are really like human mechanics. So they actually adjust the body to help you do better with whatever condition you're suffering from.
You know what we hear most? So we hear adjustments, which you've just mentioned, and then we hear manipulation. So are they one and the same, or are they different?
It's one and the same. So when you manipulate, you're actually adjusting the body, adjusting it to be in the proper frame that it should be.
Now, what are some of the targeted areas that you focus on as a chiropractor?
Chiropractors, well, we know that the human body is supported by the vertebral column. So we target this first vertebra on the neck, which is called the atlas, to the tailbone, which is called the coccyx. So the whole frame, the whole spinal column is what we target. And of course, the joints that move out from there. So the shoulders, the hip, the knees, the ankle joints, all those are joints of the body. As I said, chiropractors actually focus on the musculoskeletal system of the body, so the muscles and the joints that join up the body.
So are there conditions that maybe, will bring someone to see you as a chiropractor?
Yes. Most of the common ones that we see, Winnie, are back pains, back, neck. Those are the most common ones. So things like sciatica, things like migraines, but we also take care of pregnancy-related conditions. Women in pregnancy tend to have some discomfort. So that's an area that we do focus on a lot. So anything that's pertaining to the body, the joints, migraines, backache, neck pain, you know, arthritic conditions can be helped by chiropractic.
Okay. All right. And we usually see there's a way, like, say, for example, on the neck, there's the cracking of this way, the crack there, you pull, and then the body as well. So when you're doing the adjustments, I don't want to say the pulling and the, right? When you're doing the adjustments.
Yes.
So what exactly is that? Is it doing? Is it like opening up? Is it, you said aligning?
Yes.
Yeah, what exactly is it doing? Because you hear the sound. It's the same way, you know, like when we crack our knuckles like this, there's like a sound that is being produced. So what exactly is happening? Is it pulling? Actually, is it opening? What is happening?
That's a good question, because most people get very apprehensive with that. But when you feel and you hear that sound, it's really just nitrogen releasing in the joint space. So really what we're doing is aligning you and making you feel better, and also be able to, you know, align your posture. So you're just straightening you out. So it's nothing that's very drastic. It should be nice and soft and gentle.
I see that. I see that. And when you talk about posture as well, most of us work in offices, and we tend to first of all sit a lot and also slouch, right?
Yes.
And there was a time actually one chiropractor just looked at me and said, "Winnie, you're not aligned. You're like this." And I'm like, how are you able to even tell? But just looking at someone, right? So when we're talking about then posture, so that with that alignment, that immediately helps with posture, or does it take like multiple sessions to completely deal with that? Because it's a big issue for so many people.
Winnie, you know, habits are difficult to break. So you may want to be reminded of that. So if you're very good and you're able to follow the instructions of the chiropractor, you'll actually get yourself out of your bad habits, because we tend to slouch a lot. And actually the majority of the patients and the people that we see are young people who are completely engaged at their place of work. They're using their laptops or their gadgets, their phones, and they're just in poor posture. Even as young as 16, 15, 14-year-olds coming in with very bad posture. So the thing is to educate your children, or the children growing up, in order to be aware of what is bad and what is good, and just how to, and I can see yourself straightening out.
Let me tell you, I'm actually learning how to sit properly, because most of the time I'm usually like this. And I remember one of my colleagues one day told me, "Winnie, why you slouch? You sit straight up." Like, yeah, I try, but I find myself slouching again, you know? So it's a habit, like you said. It's hard to break, but hey, that's why we're here today, right? To correct
certain things,
Okay, so what are some of the conditions that you see commonly that people come to see you with, and especially in this day and age? And would you say there's an increase in demand for chiropractic care now?
Yes. I'll start with the conditions that we see more commonly: sciatica, shoulder, neck pain, and upper back, because of stress-related issues. There is an increase in demand for chiropractic these days, because I think there's a lot of awareness that has been created. You know, there's one of the things that came up as TikTok, and TikTok has all these videos, and young people, especially the Gen Zs, are always watching those. But I can tell you that what you watch there is a little bit more exaggerated, so don't fear chiropractic. It's just because the sound is really a little bit closer to the microphone, so you feel it and you hear it. But chiropractic is a discipline, and it's very important for you to go to a licensed chiropractor so that you're getting the right treatment. Someone who's been trained, and you can always look up these doctors. We only about 13 in the country, so we need to really know that the person that we are going to is bona fide, has been registered with the association, and has qualifications. And look at their certifications so that you don't get more pain when you're doing when you go in for those treatments.
Because remember, like I said, when you're hearing those crackling sounds, you feel like your bones are actually breaking. So really, it's important. And you see, like you said, you work with the spine, right? As well, so it's important for you to go to someone who knows what they're doing. You've been doing this for how long now?
15 years. But Winnie, one of the things we didn't talk about is part of chiropractic as a physical therapist. So I have physiotherapy on my hands, and then chiropractic.
Yeah.
So experience really works well with the person that you're going to be seeing.
I see that. Now, so when we're talking about pain, because you also mentioned chiropractic also helps with pain. You also mentioned arthritis, because we see a lot of people actually, dealing with arthritis, and they're like, I have tried all these things and none is working, right? So do you... And I know this is a very weird question to ask, but I'm just going to ask, in terms of the sessions, right? Because most of us want to feel better now.
Yes.
When I come to see you with my pain, I want to feel better immediately, right? But are there like recommended number of sessions that maybe one, requires for them to at least feel better, or it's just one off and they're good to go?
A good question.
Yeah.
Chiropractor would see you according to the condition that you're being treating. Some conditions take longer to heal than others, but it should be 6, 4, 5 treatments. It differs from the fact that physical therapy will take more sessions to get better than chiropractors, because with chiropractic you get better in a shorter period of time than physiotherapy. But having said that, the rule of the thumb is if you don't have to be ill in order to see a chiropractor.
I wanted to ask that, yes, but I'm happy you mentioned yes. Yeah.
Yes, you don't have to be ill to see a chiropractor. It's always good to get yourself aligned. And the rule of the thumb is if you're in your 10s, if you're a teenager, come in once a year. It's just like going for a dental check or going for a medical checkup. Come in once a year. If you're in your 20s, twice a year. 30s, 3 times a year. Just get yourself checked, see whether you're well aligned, get some health advice on what you should do and the type of exercises or sports that you're engaging in. Things like that would help. So every decade a visit to the chiropractor.
And you know what you said, now there's a whole lot of conversation around preventive, so it's better to just go get checked, see how your body is doing, if there's a misalignment that will be dealt with, so that you're good, instead of waiting until you get sick or maybe the condition worsens for you to go and seek medical attention. Now, the health benefits, because we've talked about pain a little bit and said, yes, chiropractic also helps with pain, but what are some of the other benefits, that chiropractic actually brings aside from pain? And dealing with the pain in itself.
Right. One of the things that is very crucial is following up the advice of the chiropractor. Because supposedly you are probably heavy, obese, and you know that you'll be, getting diabetes if you're not able to look and control your sugars. So really that advice is very important. So apart from relieving of pain, just talking to your chiropractor, knowing about your wellness and your health, and of course the stress relieving, because it really releases emotions during the time you're getting adjusted. So you feel good and you feel better after your chiropractic.
Actually tearing a little bit. It's like an involuntary.
You feel better after your chiropractic adjustment.
I see that. Now, you talked about pregnancy related and also migraines, and I know a lot of people, and especially when we're talking about migraines, people will tend to pop in pills, right? Because we want to deal with the pain there, and then because migraines are not fun at all, right? So how then does chiropractic help with that? Let's start with migraines and then we'll focus on pregnancy.
Migraines, one of the things about pain medication is it kind of covers the symptoms, so you don't really know the cause of why, but because you want a quick fix, I'll take a painkiller and I'll feel better. But after a while, the painkiller kind of, the effects of the painkiller wades off, and then you're still left with pain. So it's very important to get to see a chiropractor in order to know what the cause of that migraine will be. It could be a misalignment of the first vertebra on the spine, that atlas, the atlas is the first bone in the vertebra that carries the whole head. I'm sure most people during biology heard about the atlas was carrying the weight of the head. It could be just that is compressing the nerve that, that supplies the head with blood circulation and nervous system. So if that is compressed, then of course you have that throbbing headache. So it's very important for migraines to actually check what is a cause of migraine.
Oh, I see.
There are different causes for migraines, and having to deal with what is causing it rather than a painkiller is a way to approach migraines.
I see that. So when you're adjusting, because like I said, you see, we don't factor that. We just think, oh, maybe I didn't drink enough water, or maybe I'm stressed, or maybe we don't really focus on maybe there could be a misalignment. Interesting. I like that. Okay, so that when you're doing the adjustments, that helps to bring it back, and the pain goes away immediately, or after a while?
You definitely feel relief immediately. Yes.
Okay.
It separates, yes.
I like that.
Yes,
I like that. Okay, so if you're struggling with migraines, instead of just thinking about painkiller, maybe think about there could be a misalignment
But as I said, with migraines, you need to know exactly what is causing it. Yeah.
Okay.
It could be maybe some other cause.
So you do diagnosis, right?
Yes, we do. We do. Fast forward, we do a diagnose. Yeah.
Okay.
When you come into the chiropractic office, there's a thorough examination. We may even look for your images so that we know exactly what is going on in the vertebral column.
All right.
We do a thorough history taking. We also do some orthopedic tests just to make sure that things are what you say. So proper diagnosis. And if it's a condition that we can't deal with, we tend to refer to the other clinicians. You may need a neurologist, you may need an orthopedics, doctor. So we work very closely with the medical doctors to make sure that we are really taking care of that patient.
Absolutely. Absolutely. I see that. Teamwork. Okay.
Teamwork is very important.
Pregnancy. You also mentioned,
pregnancy.
Yes. And maybe someone is watching us and think, okay, I am interested.
Pregnancy is a very natural form of health. I always tell people when you're pregnant, you're at your best form in life, because that's what nature meant. It meant for women to conceive and to give birth. But and during that case, you, just like the human frame, if you're carrying something heavy, there may be something that has been, the baby may be sitting in a certain position that is causing a little bit of more stress on the vertebral column, and you may feel pain and discomfort. So coming into chiropractic, it's safe for a pregnant lady.
Okay.
Yeah, we are very, very sure that when we do our adjustments, we'll not be able to harm that baby.
Okay.
So we have certain techniques. We also have certain tools that we use for pregnant mothers.
All right. At what point it's sort of like recommended, because, we have the different trimesters, right? and I know sometimes they usually say, first trimester is very delicate, so take care. And also the last trimester.
Yes. The second trimester is when you can come in for your chiropractic care.
Okay.
But really, we just want you to be safe with the baby and all. Yes,
okay. So what are you looking at when someone comes?
We're looking at your posture. We're examining, seeing your limitation in movements. We're looking at yourself, your health. If there are any issues, there's some ladies who, undergo a lot of issues because of the hormonal imbalance. And of course, during pregnancy, your ligaments are really loose and everything. So exercise is one of the things that we'll advise. And just know, we are walking you through your life during that particular time that you're carrying the baby.
Okay, I see that. So a lot of people are like, how safe is chiropractic? Because again, remember, like I said, we watch these videos online.
Right.
We hear that sound. We're like, that's my bone breaking. That's not. But I'm happy that you've literally cracked that myth that no, it's not your bones breaking. It's just an adjustment and your bones getting back into proper form, right? And proper shape. But can we talk about the safety aspect of it? Because also, like we said, you're also dealing, and most of the time, with a spine. And I know, how you usually say, if you press the wrong button, quote unquote, you will mess, everything up. So how safe is chiropractic care, and how do you know where to adjust as you're doing it? Because this is your practice.
Thank you. Chiropractic care is very safe. But there are certain things that we eliminate during the time we examine you.
Okay.
There are some people who should not get chiropractic care. So we look at what we call in the medical terms red flags.
All right.
There is a condition called codequina. Codequina is really the end of the tailbone. Lots of nerves that come right at the end of the tailbone. It's like a little tail.
Right.
And sometimes because of some conditions there, you may not be able to get chiropractic. And the symptoms would be, okay, you may not be able to hold your urine, you'll not be able to hold your function down there, because that's the area that supplies that pelvic region. Those are people that you should not have chiropractic. Malignancies, especially with metastases, like the bone is weak and you should not get adjusted. So there's certain conditions that will not fractures, like if you've just fractured your bone, you don't want to adjust that because you move that particular, you disturb that formation of the bone forming back and, joining together. So during the time you're being examined, and taking the history of the patient, you need to make sure you eliminate those red flags, those things that, but otherwise it's a very safe practice.
I like that. Now, someone might actually ask, because remember, like we said, there's chiropractic and then there's acupuncture, which we'll focus on in a moment. So how does chiropractic care then differ from that? Because I know people say these are alternative, healing methods, right? So how different is chiropractic care from now acupuncture and these other forms of, alternative medicine, if we could call it that way? It's not traditional.
Thank you, Winnie. There are alternative forms of therapies, alternative forms of healing, and each one comes with its own premise. Acupuncture is an Eastern form of medicine, and I'm sure the acupuncturist will tell you a little bit more about it. But remember, the body has the same frame. We are dealing with the same structure. So doing a combination of therapies really help depending on what condition you're going through. So we're not looking at how different it is, but where the merging points are, rather than what is the difference, but how do we work together, how do we team up? And at Polycare, we have all those.
Oh, yeah, I see. And like therapies. You said, we'll be talking to an acupuncturist in a second. Now, so then how do you determine what course of treatment to give someone? Because again, like you said, you deal with different conditions. So how do you determine, say, two people come with the same condition. So then how do you determine what one gets?
Actually, it will not even be the same condition. They say all of you could have, two of them would have the same back pain. I have back pain. But depending on what is the litigating factor, some would be back pain because I'm so stressed. Others would be back pain because I lifted something heavy and I just needed to make sure that I'm doing so. So as far as the condition, it would be back pain, for example, but their history is different. What they did or what is causing that is different. So you may approach it from that. So that's where the difference comes in. Depending on what the litigating factor is.
Okay, all right.
So you say, okay, this one may benefit better or faster with acupuncture rather than with chiropractic, or this one may benefit better with any other form of therapeutic treatment rather than this particular one. So it's really looking at what is causing that condition and helping that patient get better faster and quicker. Because we know that life is so fast-paced and you need to get back to your work and to your life as it is.
Yeah, and I know right now, a lot of people, I have economy, I have to do 50,000 things.
Exactly.
To at least sustain myself. So yes, we can understand how. What are some of these common injuries that you actually see now that people present with, and maybe they might need chiropractic alongside other disciplines? Because like you said, you don't just work as an individual, you work together, hand in hand with other medical doctors to give this patient proper care. So what are some of these? Especially with the injuries we see a lot now.
Common injuries are sports injuries. People are really into exercise, are hiking, they're doing all sorts of stuff. They're going to the gym and they may, tear a muscle or, injure ligament or sprain something. So those are the common things that we see in terms of injuries. Road traffic accidents, yes, you might have a whiplash injury, like you're hit from behind and your neck goes in far extension and then you have discomfort in the neck. So really injuries at your place of work, injuries in your sports, injuries at leisure, but sometimes leisure we don't really get injured so much. But just your life, you can get an injury because the body is really supported by ligaments, by tendons, by joints, and you're working, you're doing stuff. So those are some of the common injuries that we see. And quote-unquote injuries, for some posture-related stuff that we just need to make sure that we strengthening certain muscles and correcting posture and just being able to cope with life as it is.
Kids, do you see a lot of kids?
Children, yeah. Children are very interesting. We see kids coming in, and I have seen a child who is 6 days old to an adult who's 93 years old. So across the demographics of people, because we all have the same spine. The 6-day-old was a mother who said, okay, I had a very traumatic birth, and I don't know whether this baby survived it, because so it's just check his spine and see whether it's okay. So really across the section, so as long as you have a spine, we need to look at it and see. But children are interesting because they play a lot, they jump, they do, they injure, they're always on the move, so we do see a lot of children as well.
A lot of children. Okay, but earlier on you also mentioned there's some people who should not, or quote-unquote are disqualified from seeing a chiropractic care. In my head I thought at the point, small children, like you said, 6 days. But then again, they could also... Okay, interesting. Now,
it's a technique. It's not that you're going to. It's a technique. Right? Maybe it just needs a little touch here and there, and you use your little finger, you use your little thumb. So it's not really you're using your whole big hand on that particular baby. Okay, it's just a technique. The technique, and things that you need to use.
And speaking of the same, so then how much pressure? Because you see, as a person, if you touch yourself like this and put a little bit of pressure, yes, you feel something. Right. But for you, it's different in terms of the amount of pressure that you apply and at what point, right? Yes. Do you want to take us through that in terms of, say, up here at the neck versus, like how do you know what pressure to apply?
Where? That's where the training comes in. Remember I said that we have a very vigorous training. We undergo 5 years of postgraduate training. So during that time, we also have your technique semesters. I mean, the times that we do our handling and knowing exactly how much pressure you should place somewhere and what conditions and what you should do. So, for example, you talked about the neck. The neck is a very small structure. I wouldn't place so much force on the neck like I'd place on the upper back, because the upper back, the bones are a little bit bigger, a little bit more formed, they're stronger. The lower back also, the bones are bigger, they're stronger. So it just depends on the training and making sure that you undergo very thorough training. In the States, you have to be certified. You do the board exams before you practice. And we know that the United States really is very big on litigation. So you have to make sure that you're doing the correct thing. So the training has to be very thorough. So depending on the condition, you apply less pressure and more pressure when you need to. Yeah, like a big, strong person, I would apply a little bit more force than a very petite, fragile person. Yeah, so it's just knowing exactly who your patient is and what.
Okay, so like we said, today we'll be focusing on both chiropractic care and acupuncture. We have an acupuncturist with us as well, so she's going to join us in a second. If we can take a break, my director, so that we also invite the acupuncturist to come on set and help us really understand what acupuncture is all about and how it helps our bodies. But even as we do that, as we prepare for the same, so what is it that you want people to walk out of this discussion as we close this part of the discussion? Because like I said, we'll actually do practical, part of the same, and really show people how chiropractic care is done. And I'm doing this because we're going to be adjusting both the neck someone, okay? But what is it that you'd want people to understand? And most people would ask, so is it out-of-pocket expense or is it covered by insurance as we go on a break?
Excellent. Let me start with the last question, because it is covered by certain insurances, especially the international insurances cover chiropractic. Some local insurances would cover, but it depends on the type of premium that you've taken on your insurance. So insurances per se, some of them would say, okay, come in, pay, and then we shall reimburse you, that kind of thing. Just depending on what kind of insurance you're taking. That's one. Yeah. So some insurances locally do it. International insurances do cover chiropractic. Just because they understand what chiropractic is all about. Now, coming to who should come in for chiropractic.
And say someone is coming in for the first time. What should they expect as we go on a break?
For the first time of chiropractic, well, you expect that chiropractor to be very observant on how you're walking, what you're doing with yourself. And so we really look at posture, we look at how you carry yourself. And then, of course, a thorough examination is what you should expect.
All right.
And a good history taking. So we may be a little bit more intrusive into your space, just to make sure that we understand you and you understand the condition. If you had medical reports, we review those. If you had imaging, we review that.
All right.
And then we'll do a chiropractic adjustment on you.
I see that. Okay. All right. So I'm going to say thank you for now, but we'll do a practical, part of the thing when we go upstairs.
Yes.
But for now, we also want to talk about acupuncture and get to understand what that is all about. So if it's okay for us to take a break, and then we'll invite Elsa Kren to join us on set so that we take a look at what acupuncture is all about, and then we'll actually, do the practical part of the same. So we'll see you on the other side of the break. Do stay with us. But like we said, if you have a question, please send them our way, and that is to Dr. Stower Okren, who will answer all your questions as far as acupuncture is concerned or chiropractic. Okay, so see you on the other side of the break. Welcome back to the show. The show is Your World, and just in case you're tuning in right now, today our focus of conversation is on understanding chiropractic as well as acupuncture. And right about now, we are joined by Elsa Kren, who is an acupuncturist.
I am.
Joining us today on the show. Thank you so much for making the time. We are at a different location because we want to show you how that is actually done. But very quickly, acupuncture. We see needles on the back, on the forehead, on the hands as well. What are those?
Well, actually, needles are very fine and they're not supposed to hurt that much at all.
Right?
Yes, and it's a very integral part of traditional Chinese medicine.
Okay.
So they use fine needles to stimulate tissue and muscles and blood, and then sensory messages get sent to the brain for parts responsible for pain perception, homeostasis, mood, hormones, and that's how the body responds to the fine needles being pushed into the body.
Okay. Question is, so do you have to sort of like have a condition, maybe be sick, have some pain for you to actually go through it, or you can just go through it as part of a wellness program?
You can just do it for energy levels. You can just do it if you feel a little bit low. It's very good for mental disorders. So even if you just have like a day of anxiety or a bad mood, it definitely can fix you up, just like this too. You don't need to be sick.
Okay. Do you see a lot of people come see you for what condition? So those are like two questions, are they?
Most people actually come for pain because I think it's most popular for pain relief, and it is very effective for pain relief. There's a lot of research out there to suggest pain relief is one of the most common diseases acupuncture is sought for, but it's also very good for a variety of other conditions people don't even know about. For example, blood pressure, allergies like asthma, digestive system, depression, insomnia, like a lot of things that Western medicine can't really cure and would only throw like maybe medicine on it. Acupuncture can actually get to the root of it, and with proper treatment can heal conditions, chronic conditions as such.
You know what, it's so interesting because ideally most of the time when we see needles, the first thing that comes to mind is pain. So it's interesting because you said that needles are very fine, tiny, like really
tiny. And we use like in the West we use guide tubes. So in China they would actually stimulate them into your body, which is a little bit more painful. But with guide tubes it's literally just like a millisecond of tick.
Okay,
yes.
And then that's it. So it's not painful.
We stimulate the needles to get a sensation, because in Chinese medicine, if you have a sensation, it's believed to be more effective. So once the needle is in, we have to stimulate it for you to have a reaction.
A bit of
but
reaction.
It shouldn't be painful. It's more like a dull ache. It's more like a sensation, but it shouldn't be pain.
I see that. And we'll actually have someone, come in here so that we'll see how that is done. But like you said, so different conditions. And you mentioned high blood pressure, the things that we don't think about because we just see medicine as a way to help with that. But now you're saying, no, you actually necessarily don't need to be on medication throughout. You can actually just go for a session. So how many sessions?
It depends on the condition. Like, is it chronic? How long standing has this condition been? How deeply rooted is it in you? I've seen, for example, migraine headaches go within one treatment, literally one treatment, and she never came back. She was fine. I asthma, or one treatment, she was fine. But generally, especially for chronic conditions, we would recommend 6 to 8 treatments. And then see how it goes, and people respond differently.
Okay. To make it very simple for people to understand, because now my brain is on overdrive, trying to figure how that, like you said, tip, just one, and then you, what is it called? What's the term that you use? Stimulated. Helps. So what is happening? Like, by the time you feel it, and then it goes to your brain, and then goes to the pig. Like, what exactly?
You know, that's the thing. Like, biochemically, there's no exact. It's not exactly understood yet. We know it sends signals to the brain, which then responds in form of neurotransmitters, endorphins, to balance things out. It can block pain receptors in the nervous system. In Chinese medicine, the explanation would be qi. So in Chinese medicine, you have vital energy flowing through your body. We have 12 meridians, 360 acupuncture points. So on a Chinese medicine point of view, you like deficiency of qi. Qi has functions in the body. So if there's something wrong with the qi, you either have to nourish it or you have to move it. And that's what acupuncture does.
It's all about. Are there risks that maybe we should know about as far as acupuncture is concerned?
Absolutely no side effects.
No side effects?
There's not one group of people who cannot be treated with acupuncture. Like, obviously pregnancy, you wouldn't treat the abdomen, you would treat other places. But it's even used for palliative care, chemotherapy, recovery. So like even the weakest of weak can still have acupuncture treatment and be completely okay with it.
Interesting. Okay, so say, because I've never done acupuncture before. So if I come see you, what is it that I need to expect? Are there things that maybe I need to prepare for before coming to see an acupuncturist?
Not really. Like a lot of people who scrape their tongue coats, we would recommend not to do it because we actually read the tongue and we take the pulse. So that's a big part of TCM diagnosis. So I will take your pulse on both hands, I will look at your tongue, and we will ask you a lot of questions, maybe questions like foreign to you, about like personal questions, even your lifestyle, your surroundings, your routine, everything, like your bodily functions. We'll be very thorough in questioning because every little thing will give us hints as to how we would treat you.
I see that. Now, we have, I want to say patient quote unquote, with us today to just, so that you can help us really understand what that is all about. And like you said, so as he comes, right? So you said there are specific, areas, right? That you focus on. So as we have our patients, come, so what are the areas? Because I've seen on the forehead, I've seen at the back as well. So yeah, so he's gonna lie down over here, and even as he does, So what are some of these areas that you focus on? Because it's in the forehead, and
it is completely dependent on the condition. So because the 12 meridians run through your body, it depends. Like you have points on your back which can treat the internal organs. You have points on the on the forehead who can treat the stomach issues. So it's not random, but it doesn't necessarily make sense to the Western mind. So you wouldn't treat the stomach necessarily just to treat the stomach. So different points with the connections interiorly and exteriorly. Often you can treat with the hand, you can treat the neck, or with the So it wouldn't make sense to the Western medicine.
Yeah, because I'm like, so say if I have digestive issues, I don't know if acupuncture helps with that.
It does.
It does. Okay. So say I have digestive issues, which we see a lot of people say, ulcers or indigestion, all those things. So where do you place the needles?
I would actually put some just above your ankle, maybe just below the knee. Maybe some on your stomach. And then it depends on the outside conditions, like how do you get, like what's the reason for it, and then I would maybe try to treat the cause as well as the symptoms.
Okay. All right. So we have our patient. I'm going to call them patient. Oh, you want them to?
Yes.
On the other side. Okay.
Thank you.
All right. So like you said, you don't have to necessarily be sick or have a condition for someone to come see you. No, it doesn't have. You can just come for like general wellness.
Yes, but to be honest, in Chinese medicine, no one is actually ever perfectly healthy.
100%.
Because you have yin and yang, and the body is always waxing and waning. So one day maybe a little bit insufficient, the next day. So we can always find something. If you want to find something.
And our lifestyle now, right?
Exactly.
And our lifestyle now. Okay, children. Do you see children? Is it safe for children as well?
It is perfectly safe for children.
Okay.
I don't see many children in my practice, but I know it's perfectly safe for children. My nephew is actually having treatment in Austria for eczema, and very successfully with acupuncture.
Oh, really?
So, yeah, but personally not many, but it would be definitely safe.
Okay, all right. So we're ready. Are you ready? Let's see.
Yes.
Okay, so you have your needles, like you said, and the needles. Okay,
yes,
all right. So you wanna, do you wanna go all the way around so that
yes, sure.
You can be on this side so that we see you, and we see you.
I'm just gonna disinfect my hands, because that's another thing I think very, very important when you see an acupuncturist. Make sure they are clean. These needles are not reused, like one use, sterile needles only. Hands should be washed and sterilized regularly. So that I think would be important.
Okay, all right. And then you have your, okay.
And then it looks like this.
Some of us
We're not going to do too much on him today, but these are the needles, so they're very fine. They have guide tubes, like I said. Like in China, guide tubes are not commonly used. But for us, here we use them.
They're tiny.
I know.
Look,
I think people expect it to be.
Yes.
Yeah, but actually it's very, very thin and very, like obviously it varies, but these ones are like ones I use commonly.
Oh, wow. Okay. All right. Okay. So there you go.
My patient had treatment with me before, so he knows what to expect.
Okay. All right.
Okay, so
and then
start with here.
Okay. So what is that you're doing when you say you start?
Oh, this is a very good point for like move chi in the body. Like together with the one I'm going to use in your hands, it's called Sumen, which means 4 gates, which is one of the most commonly also used, like I mentioned before, in palliative care, in cancer patients, any kind of chi stagnation. You can use these points very good.
Okay.
This one might be a little bit sensitive because it's the feet.
Yeah, because I had him.
Yeah, some points are more sensitive than others. Like obviously the face will be more sensitive because you have more blood vessels. Yes. And the face is more likely to bleed too. So if you just do... Are you okay, my patient?
Okay, okay, they are okay. They are okay. All right. So say if, again, like you, with your patient, I know we do not want to disclose too much, but what exactly was the condition so that you're treating?
For this, we're just going to treat his energy levels in general.
Oh, energy levels.
Yeah, and like the spirit.
Yeah, I see that because a lot of people actually say, you know what, I have low energy, I feel fatigued, I feel not myself, I feel not 100. So this helps.
This helps.
Okay.
I think we're moving from the time where we thought disease is just physical to understanding that disease is actually a whole, we're energetic beings, like physical but energetic. So I think we come to understand that just treating the physical sometimes is not enough. And there's so much you can do around it.
Yeah. Okay. I see that. So, and then you see that, like the specific places that you've placed, you know, the needles.
Yes.
Why not here? Why not here?
We actually study a long time to learn all those points.
Right?
Yeah.
Yeah. And then you know where exactly.
Yes, well, like for example, if I would needle other points, like I would always look at the patient's hands first to measure, because in Chinese medicine you measure with your fingers.
Oh, really?
So like this would be 1 sun, this would be 1.5, this would be 3. So if I would use another point, I would go here, and that's how I would measure, and then I would feel the tibia, and then I would find out it's at the posterior border, and that's how I would then go to like some are easier to locate than others, but especially for things like on the stomach or the back, I would use like the patient's measurements. So it's individual to the patient.
Oh, interesting. Okay. You know what? I am tempted. I'm like, can I?
Yes, of course.
Okay.
Yes, sure.
Can we do it? Okay. Do I have to like lie down, or I can just do it?
We can just do the 2 in your hands. Then you can just sit down and relax.
Okay. Sit down
Maybe
and
you can even sit
here.
here.
I can just sit here. Okay. All right.
Let me just clean up again.
Okay. All right. So you're gonna do on my hand.
Yes, on your actually here. This is a very good point for a lot of things actually. Like I said, it's commonly used for headaches, toothache, neck pain, but also very good for energy and.
Yeah, like yesterday I had a terrible migraine, and today I feel better.
See, very good for headaches.
I feel much better, but yes, okay, so...
Let's do it.
Okay, so for those of us who are like scared of needles, okay, here we go.
Okay,
let's
just relax.
Okay, so can you...
Yeah, do you want me to come around here?
Yes, yeah.
Wait, maybe I'll go around here.
Okay, all right. Our set is a bit minimal in terms of movement, but yeah.
Okay.
Okay,
So
all right.
here I would measure like this. And it would be right about here.
Okay.
And then I would ask you to just relax.
Okay. Relax. Okay.
Then I'll sterilize the area.
Okay. All right.
The needle, the guide tube.
Okay. All right.
And it's done.
That's it.
And now I have to stimulate it.
Okay.
Can you feel it?
Yes.
Is it painful?
No, actually,
I have to move it a little bit more.
Actually, no. It's not painful.
No.
And then that's it.
And that's it. And then we would leave it like commonly between 15 and 30 minutes.
Okay.
And then you can relax during that time.
Okay.
And we just take it out.
Let me tell you, you know what? I am one of those people who are like, needles, Do you have options? Give me medicine. But this, no.
I know it doesn't.
And I'm being honest, I did not feel, you just feel like,
yeah,
and then that's it.
I think some places are more sensitive. This can be sensitive. This point can be potentially sensitive. But
yeah, I am actually doing good. I'm just going to say that. So like you said, so if you're struggling with like what, low level, now I feel it. Now I feel...
Yeah, toothache,
yes,
headache, neck pain, low energies in combination with other points also often used. A good point to be combined with others. So this is one of the most commonly used ones.
Oh, I see. Okay. And you also talked about other conditions, say high blood pressure, talked about hypertension. So then where do you place the needles? And like you said, again, it depends on the condition.
Completely.
That informs the number of sessions and also the mode of treatment. But so ideally, where would you place the needles?
Well, I think probably the 4 gates would be a good one for blood pressure too. It depends, if it's stress related, is it lifestyle related, is it low blood pressure, is it high blood pressure? It's like, I think every patient is very individual.
That's true.
So I would probably every treatment looks different. And even with patients who come regularly, conditions change. So the treatment will change. So it's entirely dependent on,
Okay, I see that. So then now understanding our lifestyle and understanding, because most of us actually work in offices, so we tend to sit a lot, and sometimes we slouch, okay? So a lot of people come complaining of, back pains and neck pains, migraines, as well. And then the fact that we're just sedentary, most of the time. So what is it that you see most? What are some of these common conditions that people actually come see you with?
Yeah, repetitive strain injuries like driving or laptop, carpal tunnel syndrome is also very easily treated with acupuncture. But then we would also try, because Chinese medicine is holistic, so we would give lifestyle advice. I would probably advise you to take up exercise like Tai Chi, Qigong or yoga, something that builds energy in the body, not necessarily fitness, but something a little bit more overall mind, body, spirit kind of exercise.
Okay.
Or even show you little exercises you can do at home. I would also ask your diet, because some certain foods increase inflammation. So if so I think it would be a whole process of asking, finding out, and then not just putting the needles in, but also trying to lead you to a better lifestyle.
I see that. Okay, so the people at home say they want to see you properly. So if you want to just, fantastic.
I've been distracted.
Right, and we understand, totally understandable, because this is your forte. So for like you said, so again, depending on the different, types of conditions, you would know what to do in terms of treatment administration. Now, for people who just come for general wellness, right? Is there a recommended number of times that maybe someone should see you? I know for chiropractic, Dr. Stower said, if you're below 10, once a year, in your 20s, maybe twice a year, in your 30s, thrice a year. Is it the same for acupuncture, or?
It depends on if you just want a little boost because you're low energy and you're not feeling great, then I think once is enough. But if there's if you come because you have slight issues, then I think definitely mostly we recommend 6 to 10 treatments, somewhere in between, and then
all right. And then how do you space that out?
Weekly.
Oh,
weekly works best.
Okay.
So if you can come the same time every week would be ideally, and it's completely safe to be combined with any other therapy. So there's no medicine or anything you cannot take. You can come and have acupuncture. So it's perfectly safe to go in combination with other things.
I see that. Wow. Okay. So then now, as we come to the end of this session, because we also want to see chiropractic, the adjustments and how that is done, for someone who's watching us and saying, okay, I have, say, this condition, say back pain, I have dealt with neck pain, I have dealt with pain, in the joints as well. What is it that you'd want want people to know about, first of all, acupuncture, and then do you work with other doctors, say other disciplines as well, to just ensure that, you know, a patient gets, you know, all the care that they need? Okay.
Like, sadly, not yet. I think if like Western medicine and like things like acupuncture would work together, it would be much better. Also, I don't think you can get acupuncture on insurance, so it's like it's different sectors.
Oh, I see.
But yeah, I think it would be great, like definitely. And I think more and more, like we recommend each other. So if I see a condition, I think Western medicine would be good, I definitely would say, please go and see your GP. And I think vice versa, that a GP who knows about acupuncture would recognize if a patient would profit from it, and then would say, listen, why don't you just try and see an acupuncturist for this?
I see that. Now, for people who are like, you know what, acupuncture could be, you know, the traditional Chinese, you know, aspect of the same. And now we're seeing a lot of people actually just taking it up because they can easily go on YouTube, you know, Google, see how it's just needles. Someone gets needles, right? And goes ahead and uses it, right? What is it that people should actually be on the lookout for when it comes to an acupuncturist, right? What are the questions that people need to ask for them to actually go to, you know, someone who's licensed, right?
Yeah.
What are some of those questions that people need to be on the lookout for so that you don't just go see anyone who pretends?
Yes, and I think licensing is different, like in different places, different licensing, but definitely should have a certificate of some kind of university or accepted school, like widely accepted, like not renowned school people know about.
Yeah.
The other thing I think is what would be good if you're looking for an acupuncturist, maybe word of mouth. If you know somebody who knows somebody and they had a good experience, ask them and find out. I think nowadays, even like online, you know, you can read the reviews, you can check out the website, you can see if you feel good with it. But yeah, I think nowadays we're lucky we have many like possibilities to find out.
I see that. I see that. Thank you so much.
Let me take this out
so
for you
much.
because
Okay,
you've
all
been
right.
had it for...
Yes.
Thank you so much.
Nice. All right. And then do I need to hold this?
Usually just a little bit. Like it doesn't.
Fantastic.
You see, you're fine.
Okay, right?
Are you fine? See? No, I have to hold it a little longer.
Okay, a little bit.
I spoke too soon.
It's okay. It's okay. And thank you so much for really, you know, taking us through,
Thank
you know,
you
the
very
entire
much.
process of acupuncture. Acupuncture, because a lot of people actually don't know what it's all about and some of the conditions that it helps with. So we want to say thank you.
Thank you so much
very
for having
much.
me.
Do we want to leave him to just rest for a while?
Yes, I'll leave him here for a little bit longer and then.
Okay, all right. Okay, so then I think we'll have Dr. Stower join us, but then again, we'll have to use this face, Dr. Stower, if this is okay with you, you know, so that we really get to see how that is being done. But remember, the conversation today is on understanding chiropractic care and acupuncture and what that is all about and some of the conditions that it helps with, you know, and like both have said, that is Dr. Stower and Elsa have said, that you don't necessarily have to be sick for you to actually, you know, get this care. It's part of a wellness program as well. So if you are in your, say, below 10, once a year for chiropractic care, in your 20s, twice a year, in your 30s, thrice a year, and of course that, you know, continues. But remember, they also said there are some people who do not, quote unquote, qualify for chiropractic. So before you go see a chiropractor or an acupuncturist, then visit your doctor, get to understand your condition, and then, you know, you can incorporate all these other alternative therapies for healing, all right? And Dr. Stower is ready for us?
Yes, I am.
There was a question earlier on for you.
Right.
And this was actually brought about by our producer, Mbaya, who said, you know, we men, we go to kinyozi. All right, and then how, what is it called, after the process of the haircut, right, and getting the haircut done, there's that massage, and they do this, and then they rotate your head, and they, you know, do all those things. Is that dangerous? Is that risky?
I want to warn Kenyans that really getting you know, that cracking from the barber is not good, because you remember our training, we're trained to know exactly which vertebra should move.
All right.
So it may feel good, but it's really can be dangerous for you.
Yeah.
They can tear a vessel in the vertebral column, and then you'll have stroke. So it's not really good.
See.
You can tell them now, you can massage, but do not twist and turn my head. That's one of the things that Kenyans have to be aware of.
Okay.
And as we said, always go to a qualified chiropractor, a licensed one, and you can find us online and check up your people, read about their qualifications, know a little bit about them before you go in and see a chiropractor.
Absolutely, just because they're cheap. Or they're in your neighborhood, just up around the corner. No. Do your background checks.
Do your background
Please do. Because over the time, right here in the country, we've seen, a rise in terms of, quacks and all those things. You do not, and the results are not good. People actually lose their lives. So do the bare minimum and do your research, okay? All right, so you're ready to show us hey, a bit of chiropractic and what you're going to do. And quote unquote, we have our patient.
We have
Thank you for joining us. Where do you want him? Do you want him?
Eric, what we want to do is just stand here.
Okay.
We're going to look at your posture first.
Okay.
One of the things that I look at is posture. So let's stand against this grid and so the posture, you're looking at his shoulders, the way the shoulders lie, the way he lies on his face, and actually you can see Eric has a way of tilting a little bit this way, and if you look at the pelvic, you find that the left one is a little bit higher than the right. And these are things that we just get a critical look and see. I'd sometimes ask him to just walk. I'll ask my patient to walk around a little bit and see whether he's leaning up to one side and just walk around this area or walking. Yeah, that's pretty good. All right. And then, of course, we'll go into some examinations. I want you to stand here and try and touch your toes. If it hurts, don't go, but let's see. This way, we are looking at the flexibility. We're also looking whether there's a little bit of misalignment. Sometimes people with scoliosis, that's the curvature of the spine, would actually rotate to one side rather than the other when they're touching their toes. But I'd like you to sit here, Eric, and face this side. I'm just going to examine your neck to see what movements you have. And I want you to look up to the ceiling, drop your head back. Is that maximum? Can you go farther out? That's it. And then chin to chest. Excellent. Any discomfort?
All right.
Right. Look over your right shoulder. Good. And look over to your left. Yeah. And you can see he has more motion in the left than the right side. So I'll go ahead and actually feel the vertebral column here.
All right.
Just to make sure that
is it possible for you to walk on your side so that even the people at home see what you're doing? I know it's difficult, but
cool.
Is that okay? Fantastic.
Yes, okay. One of the things we look at is actually his tension in the muscles, and it's just observation. That is what we go for training for. So you'll see how he's holding, and you can see this one is a little dropped, this one's a bit higher. If you have a very critical eye, you'll see that one shoulder is a little bit higher than the other. Maybe it's just a habit. Maybe he holds a lot of his laptop or something on the left arm. Maybe he's left-handed. Are you left-handed? No, because you just look and observe certain things. Eric, I'd like you to lift up your right arm, straight up, right in front. That's it, and down. Good. How about your left? That's it, and down. And I'm just looking at the movement in the shoulder. I want you to take your left hand and hold your right shoulder. That's good. And then from behind, the other side, go right through. That's good. Well done. How about the other side? Go hold here. That's good. And then from the other side, and we're just looking at the motion. Some people would find there's a little bit of limitation, then you know there's a lot of tension in the shoulder joint. Okay, I want you to place your, hold your elbows this way, 90 degrees at the shoulders, and place your forehead in there, on your arms. That's it. That's good. That's it. Okay, we'll go up. Together, go, 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 go. And this way we're just checking the motion in the upper thoracic area. Excellent. All right. Any discomfort? Now hold your elbows, your shoulders, right to left. And that one I'm going sideways just to look at the rotation, because the body is really three-dimensional. We move left, right. We also move right and left, and then we rotate. Go to the right side. So we are three-dimensional. We're looking at how the motion now on that, not too much, but I can feel the tension here.
Wow.
So what I'd like to do is check his vertebral column. I want you to lie on your tummy, face down, excuse me.
Okay. You know what, it's so weird because looking at him, I'm like, he's fine, he's okay. But you're able to tell just from looking at him
certain things.
Wow.
Most of the time you're looking at the fluidity of the movements, the tension in the muscles, the limitation, anything else that is going on. Do you have any headaches? No, no headaches.
Okay, okay.
Lie on your tummy, face down, and place your hands here. place your hands here.
So ideally, Doc, how long does this a session take?
There's some chiropractors who do this in 15 minutes.
Okay.
I tend to take a little bit more time because I talk a lot.
Yeah. Okay.
And ideally, a session should take like half an hour.
Oh, I see.
Or,
I see.
Yeah.
Okay.
Or an hour, you know, that kind of thing. Here we are checking the motion in the leg and the knees. We're also checking the leg lengths. Sometimes you find some people a little bit longer than the other, so they're not completely symmetrical. And that comes from strain in the ligaments right here. So you really have to check and find out how that is. Okay, so I really know that you want to see an adjustment, but let me just go through some motions with him before, and here I'm checking how his rotation in the hip is, just to make sure he's okay. I'll give a little bit of a pull here. If you have a patient with a lot of pain, they'll actually say, "Ooh, that's here."
This is painful.
But Eric here just came in for a check. And we also palpate. And as you said, palpation is very... Eric, you're just going to open up your spine. It's going to be on camera, but that's fine. And I'm just feeling your vertebral column. And of course, Eric had given me permission to do this.
Okay, okay, yeah, we knew, yeah, definitely you need, you need permission for that.
Yeah, permission for that.
Okay.
And this table has got a feature. I'm just going to lower it down, Eric, for you. Yes, just relax. Just relax. That's it.
Okay.
So over here, we can actually look at the vertebral column. We have 24 vertebrae, one on top of each other. So what we tend to do is feel the motion in the vertebra, one on each other, and see the area of restriction. And it's really a fineness of the art that we have been taught on how to do this. And when you feel, you can actually feel the tension building up in here. And that particular one here. So I'm comparing the right and the left. Any pain? A little bit of discomfort? There's a little bit of discomfort.
Okay.
So we're going to go. I'm going to focus on his neck area, and I'll also focus on the hip area here, the pelvis, because I could see that one is a little bit higher than the other.
Okay.
So it's really just analyzing, seeing which one doesn't move very well, and going across and manipulating. A manipulation is very easy. It's really a force into the vertebral column. You may feel a sound. It's like when you knuckle your fingers and you feel a pop sound. But as you say, it is just nitrogen releasing in the joint space. So Eric, turn around.
Okay.
It's going to be nice and easy and not too drastic on there. Right. One of the things I do is just look at the motion. See there, that goes there, and that goes here. Actually, he just kind of... I'm going to adjust your second vertebra in the back, in the neck area, which is here, and just relax in there. That's good. And here. Relax, relax, relax.
Yeah, I had that.
See, not too bad. How was it? Not painful?
Oh, nice.
Okay, so that's what we'll do. We'll do your hip area. So we've just adjusted your neck here. It could be just the way you tilt your neck this way all the time. There's a little bit of tension on that particular
on one
area.
side.
On one side.
Okay.
Because the muscles of the neck attach from the shoulder to the neck area. So
I see.
Constantly pulling. The body is so interconnected.
Right.
I want you to lie on your right-hand side.
Okay.
Face the side. Okay. And I'd like you to hold your elbows, very nice and easy. Hold your elbows this way, elbows, and turn to face the ceiling. So you're a little bit turned this way. Eric, to make you comfortable, I'm just going to give you a little pillow. There we go. That's it. I want you to bend the top knee. That's it. That's good. I'm going to hold you here. We're adjusting just the lumbar this way. All right, just hold here. Just hold there. That's it. Your toe. And I want you to look at the ceiling. Look at that side. That's it. Do you see that? The other side. I know. It's like, oh. It's
Are
like
you
just
okay?
aligning.
Right?
Are you okay? Again, you're going to move you a little bit. Prop you up a little bit. Just relax. It's not going to be painful.
Yeah.
Nice and easy. All we're doing is just aligning the pelvic region. And of course, this is because of sitting too much and, you know, doing the way we do our stuff. It stabilizes here and you just place a little bit of force here. That's it.
How does that feel? It feels good. Yeah?
Good. Well done.
Oh, yeah? Oh, nice.
And probably check onto the motion. So Eric had just tension in the back and the neck area.
Yeah.
Because of sitting, because of the things we do. And of course, Eric, you do play a lot of sports, football? You need to stretch a little bit more in your hamstrings and your calf muscles, right? Kind of tight. You should be able to really be flexible, right? Yeah, that kind of thing.
Okay.
So stretch, 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 stretch. So stretch is very important for
right?
the body.
Yeah.
And we always advocate for yoga because we have yoga also in the clinic.
Okay.
Yeah, so
all right.
yoga does help with a lot of stretches. So if you want wellness, it's chiropractic, acupuncture, yoga,
right?
things like that would actually get you going.
I see that. And you know what? Speaking of what is it called? Stretching and all those things. Sometimes, oh, you okay? Ah, fantastic. Okay.
All right. Thank you so much, Eric,
yes, thank you so much, Eric. And you did so well. You did so well.
Thank you. Thank you so
and even
much
as we allow Eric to
just drink plenty of water and relax a bit.
Fantastic. Thank you. So as we bring this to a close, most people actually go to the gym, and after the exercises, there's this time to, you know, stretch here and there, and you might find some instructors also want to help you stretch, right? Because I have seen others actually do these and, you know, try to press on your spine and all those things. What do you have to say to that?
Exactly. Again, do not let your guy stretch you. Most gyms, and these days, they tell you to stretch. They will instruct you to stretch. And if you stretch and it, you know, pops by itself, that's natural. But don't let anyone force it.
Yeah.
If they're not qualified, if they're not chiropractors.
Yeah. Until they hear that cracking sound, they say, but don't just stretch, and then they
No, that's a no-no.
Okay.
Let them just give you the instructions, but don't let it be forced. If you're stretching by yourself and you feel a little click, that means the body's just resetting and reorganizing itself. But don't let the gym instructor It feels good, but it's not safe.
It's not safe. I like that. As we bring this to a close and say thank you so much for your time today and allowing us into your space. A lot of people are asking, where can they find you? So as your practitioner, do you want to just tell them where you are?
Right. Thank you so much, Rini. We have two practices, one in Lavington Green Shopping Mall. We are located in Lavington Green Shopping Mall, just above the Absa Bank. And then this is a second practice, which is in Nyari South, Bishopsgate, off Gacha Road. Yes.
All right.
Our telephone numbers, call 070000 3888. So it's 0700 3888.
I see that. Thank you so much, Dr. Storer. Someone actually here on Facebook said, this is Jewel Jules, who said, pain leaves like immediately. You feel like a newborn. And said, one, that is a gym instructor, cracked my hip and shoulders. It was the beginning of my painless and tensed body. I had watched so many videos of chiropractor every sigh I made. Okay? So like you said, be very careful. Not everybody should crack you up. No, because it can be unsafe sometimes. All right. Thank you so much. We have to end this part of the conversation, then have a different conversation that is on ending malaria in Kenya and in Africa as a whole. So we'll see you after the break. That conversation is coming up very, very shortly. But for now, thank you so much to Dr. Storer and Polycare Wellness Center, together with Kren, for hosting us today and taking us through what chiropractic and acupuncture is all about. So now you have all the information, okay? So you know what to do with the information. But we'll see you on the side of the break. Do stay with us. The show is Your World.
Thank you.